Dear colleagues, I'm glad to present you our study about the prevalence of physeal changes of the distal metatarsal growth plate in finisher bulls. For meat producer, the goal of fattening is to gain maximum weight in a short time, but the growing skeleton is also a vulnerable structure. A trigger to this study was the fact that we see sporadic cases of bred heifers referred to our hospital, typically showing progressive mild to severe lameness, as well as outline changes proximal to the fetlock. On radiograph, we see a widening of the growth plate and moderate sclerosis of the adjacent meta and epiphysis. Prevalent lesions in finisher bulls were also reported in 2017 in the literature. The aim of this study was to assess the prevalence of lesions of the metatarsal growth plate in bulls at the end of the fattening period, to describe their radiologic changes and histologic appearance, and to evaluate the need for further investigation. We collected hind feet of 104 bulls during normal slaughter process. Hind feet were packed by pair and identified with the ear tag of the corresponding animal. At the slaughterhouse, the feet were then brought to our facility and washed, and the cut surface was covered to facilitate a clean further assessment. With the ear tag, we had access to the age, breed, and producer of each bull, and from the slaughterhouse, we had access to the weight at slaughter and the carcass taxation. On the basis of the weight at slaughter, we calculate the mean daily weight and the mean relative growth rate. To evaluate the bone changes, a radiograph of both hind limbs of each bull was achieved in plantar-dorsal view with a central beam on the distal growth plate. The feet were X-rayed pairwise. The X-ray were assessed on the basis of a protocol established for this study, including the soft tissue, axial deviation, bone lysis and sclerosis, regularity and width of the growth plate, as well as lip formation. An overall appreciation, as well as a weighted score, was established for each foot, and in the same step, photographs were shot for documentation and to allow a comparison between clinical findings and radiographic changes. The software SPSS was used for the statistical analysis. In addition, 7 foot pair with different degree of radiologic changes were chosen for CT examination. CT images were assessed in the same way as radiography. 6 of the foot pair that were examined by CT were also examined by histology. Finally, the claws were visually assessed for sole length, heel size, presence of an axial slope, appearance of the hoof wall and white line, and presence of digital dermatitis or heel erosions, and also trimmed for assessment of deeper claw lesions. To the results of the 104 bulls, 2 foot pairs were excluded. One animal was registered as a female in the data bank, and one showed a salteraris fracture type 2. The bulls came from 20 different owners. Fattening was achieved under 2 different labels. 15 breeds were represented, but only 13 animals were purebreds, and most represented crossbreds were Brown Swiss cross Limousin, Simmental Red Holstein cross Simmental, and Simmental Red Holstein cross Limousin. The median age was 406 days. The median carcass weight was 303 kilo, and the mean daily weight gain was 638 grams. The carcass taxation, 74% of the animals were in the upper 3 categories, and the fat was evenly distributed among 82 animals. Only 10 gross plate were without radiographic changes. 62% of the gross plate showed mild to severe radiographic changes. In terms of bulls, 66 bulls showed mild to severe radiographic changes. As I said before, we also had a weighted score to make an objective evaluation of our overall interpretation, and we had a high correlation between the overall evaluation and the weighted score. Also interesting, we found a light but significant higher score for the fourth metatarsal bone in comparison to the third metatarsal bone. Here you see a representation with the different grade of radiographic changes. Here with no changes to both the last two with high changes. With the black arrow here you see a narrowing of the growth plate and a distinct lip formation here. On this one you see a distinct sclerosis of the adjacent bone of the epiphysis, a bone lysis, and also with the white arrow here, a clear widening of the grow plate. Production label, weight at slaughter, mean daily weight gain were significant factor for the weighted score of radiographic changes. The producer were also a significant factor, and further in the statistic we could find also a significant difference between 3 different producers. No significant factor were the age, carcass taxation, and the mean relative growth rate. Here you see a representation of the clinical findings, radiography, and CT examination. Here you can note the clear regularity of the growth plate in radiograph and in CT. In comparison with one bull with severe changes, you can note here on the clinic on the line distinct outline change at the level of the growth plate that we see here as a distinct lip formation, bone proliferation at the level of the growth plate, also visible in CT. For the histology, we can say that the histology corroborates the radiologic changes. The regularity and width of the growth plate, as well as the arrangement of the chondrocytes, was clearly assessed. And we found a large difference between growth plate without and those with severe radiographic changes. On the left, you have an overview of a bull without radiographic changes. The white arrow are showing the growth plate. You have here the metaphysis, epiphysis, proximal sesamoid bone, and the fetlock joint. Underneath, you have a view of the enlarged view of the growth plate, which shows light waved appearance, and on the image underneath you can see the regular arrangement of the chondrocytes in columns. And that is representative for unaltered growth plate. On the right, a growth plate with severe changes, the overview here, and what we see on this picture, there are abnormal cartilage tongue that are protruding in the metaphysis. And on the image underneath, you can see the irregular circular arrangement of the chondrocytes. Here we are two detailed view of this abnormal cartilage tongue with the arrowhead showing a gap through the height of the growth plate, as well as area of calcification. And on the other image, you can also see a gap that is filled with cell detritus. About the claw, we found in 69 feet digital dermatitis, in 165 feet heel erosions, also sole hemorrhages in 100 feet, in 63% on the lateral claw, and in 4 feet white line disease. Animals in our study were selected during normal slaughter process. The question is if the true prevalence of physeal changes higher is. We can suppose that at least the animals with severe alteration were painful and lame, as it is described, but it was perhaps not seen in the mass and stress situation of the slaughterhouse. The growth plate is a complex anatomical structure, and its assessment with radiograph is difficult. Furthermore, there is no other study on the normal appearance of growth plate in fattening bulls, but the histology corroborates the findings and relevance of the radiological changes, and the histological changes, as we see just before, are consistent with osteochondral lesions. Interestingly, we found few claws alteration. In conclusion, we found a high prevalence of growth plate lesions. Radiologic and histologic changes were consistent with OCD lesions, and CT and histology confirmed the quality and validity of radiography. The impact of rapid growth due to intensive management and feeding on the growth plates is scarcely known, but our results suggest a widespread problem in the management of fattening bulls in the area examined. And it is probably important in terms of animal welfare. Housing and rapid weight gain are likely to play an important role in the pathogenesis of these osteochondral lesions. To conclude, lameness and radiographic examination are required to assess the disease prevalence on different farms. Thank you for your attention.